Therapy is supposed to help kids, right? Well, sometimes it does not. And sometimes therapy not only misses the mark, but it can actually make things much, much worse. And I know this because I lived it. I had 7 therapists throughout 20 years and many diagnoses, medications, a whole lot of help that really just poured gasoline on an already big fire. Tonight, we're going to be talking about something that is very important: bad therapy, worse parenting, how good intentions can go horribly, horribly wrong. Welcome to the Anti-Alienation Project. First of all, my name is Maddie. If you're not familiar with what I do here, I talk about a certain type of psychological child abuse that I went through for 20 years. This often happens in the context of a custody battle or divorce, but it can happen in intact families as well. And it really involves the manipulation of a child to reject their other loving parent. So tonight is my first episode of a new 3-part series that I'm going to do. So welcome to part 1. So tonight we're going to dive into the intersection of therapy and alienated kids.
You come to the conclusion that the enterprise is doing more harm than good. And what evidence is there for that, do you think?
Well, because they're not treating the sick, they're treating the well. So we know that the risk of iatrogenesis, of the healer introducing a harm, is greatest when you're treating people who don't need the treatment to begin with. Okay. So we know that if you're gushing blood, going to an ER is an important thing to do. It's necessary. It's life-saving. But if you have a small bruise, you're much more at risk of getting an infection from the ER, picking up, a MRSA or some other bacteria from an emergency room visit than you are, than you stand to benefit. And the same is true with preventive care. We shifted from treating kids and treating adolescents with severe mental health problems to the idea that everyone should have therapy. And there we exposed a vast population to risk, the risk of all the known harms of therapy.
So when I first heard this concept a few weeks ago, it was actually surprising to me. These claims that Abigail Shrier is making in her book is that psychotherapy is indeed harmful, or it can be, and that you shouldn't send your kid off to therapy until or unless they absolutely require it. And I do think that this claim really does stand in the face of how many people in society view therapy. I mean, especially parents. I've heard before that the claim that, quote, anyone can benefit from therapy or everyone needs therapy. And I don't think that's necessarily true, especially not after reading her book. For kids who are manipulated to reject a parent, we have obvious issues with therapy, very clear issues with therapy. And if you're here watching this video as a parent or a kid who's experienced this dysfunctional family dynamic, you are probably familiar with the basic issues regarding therapy for alienated kids. I'm talking at the macro level, the big level. So let's break it down real quick. Number 1, the reinforcing of false beliefs. Affirmative therapy will assume that the child's narrative and the alienating parent's narrative is fact. The therapist will often take this narrative at face value. They might encourage the child to go little contact or no contact with their targeted parent, which deepens the rejection, obviously, and will make the reuniting down the line that much harder. The therapist often validates the child's fears or hostility towards their parent and enforces the alienation in that way. Furthermore, talk therapy can reinforce the false beliefs that the child holds about their parent. And this is an important point I want to make. The fact that this therapist, an outside source, is buying into the child's experience, that strengthens the delusions in the child's head. Because now not only do you have their other parent saying these things, and believing these things, but you also have a therapist saying and believing the same things. The second problem that's pretty obvious for alienated kids and therapy is the therapist being aligned with the alienating parent. Now, this is child therapy, individual child therapy. Often the alienating parent will approach the therapist first. They do this very strategically. They do this to set the scene. Now, You see, when you are the first to tell someone something, their perception can be biased by this information, and often is. This is actually a phenomenon. It's known as anchoring bias or primacy bias. Anchoring bias is when people rely too heavily on the first piece of information that they receive. So basically, if I tell you this guy is a narcissist, this guy is really selfish, you're more likely to believe it just because that's what you hear at first. So you're going to see this new guy that you meet and you will see him through that lens. It's using information as an anchor or a reference point for all subsequent information. And alienating parents know this, and that's why they go to the therapist and set the narrative first. And the third overarching issue that I see personally for children going through this with therapy is the failure to involve the whole family system. And we're going to talk about this more in episode 3, so in 2 weeks. But basically, effective treatment for this particular child psychological abuse is not individual therapy for the child. It is family systems therapy. And we're going to talk about this again in episode 3, so in 2 weeks. And this is not anything that I came up with. This has been brought to the public by Dr. Childress and Dorsey Pruder, but this has been around since Mnuchin and for decades. If therapy in this context isn't based in a family systems approach, the therapy will miss the source of the problem, the harmful parent, leaving the child stuck in the abuse. Now, you also have issues with individual therapists themselves. For instance, a therapist might not protect the child for a few different reasons. I mean, maybe the therapist is afraid of the pathological parent. Maybe the therapist is afraid of losing their license. And another example is a therapist just being incompetent. Maybe they're unfamiliar with the dynamic. They don't know any better. They don't have the right education. So I was at the library a few weeks ago, browsing the shelves as I like to do because I'm a nerd and a reader like that. And I came across this book, Bad Therapy by Abigail Shrier. I encourage everyone to get your hands on this book and read it. Abigail Shrier is an investigative journalist who has published many international bestsellers. She is a little bit controversial, but anyway, I began to read this book. And honestly, I just found myself unable to put it down. I had never considered therapy being harmful in this way. In the book, Shrier argues that the problem is not the kids. It's the mental health experts. And she draws on hundreds of interviews with child psychologists, parents, teachers, and young people to expose the different ways that the mental health industry has transformed how we teach, treat, discipline, and even talk to our kids. She reveals that most of the therapeutic approaches we have for kids today have serious side effects and few proven benefits. She says, any intervention potent enough to cure is also powerful enough to hurt. Therapy is no benign folk remedy. It can provide relief. It can also deliver unintended harm and does so in up to 20% of patients. And alienated kids are uniquely at risk of that harm because of their fractured reality. They are made to live in their parents' delusion. Therapy is not inherently safe. I'm going to start by playing 2 short clips of Abigail Shrier explaining the incentives of therapy to Joe Rogan.
Also, the incentive is for therapists to treat the least sick for the longest period of time. That's the incentive. Because you don't want the schizophrenic patient who really needs you.
Right.
They're really hard to treat.
Almost impossible.
Almost impossible, right? You don't want the bipolar patient.
Right.
Some people will refuse to see those patients. But a teenager with a little social anxiety, parent pays on time, they're not getting violent in your session.
Oh, boy. Wow. I never really considered that until your book.
So that's one thing to consider. Alienated kids are being treated for the wrong issues. They're often diagnosed with anxiety, depression, OCD, insomnia, whatever it might be. And their real problem is that they have an abusive parent. Let's watch one more clip.
Yeah, a lot of therapists.
Yeah. How many of them agree with you?
So there was a huge split. The academic research psychologists overwhelmingly agreed. They were aware of the literature and they said, yeah, these are bad practices. Here are things we shouldn't be doing with kids. What was interesting is a lot of the clinical therapists were either minimized the risks of therapy or denied that there were any.
But isn't that like Jiffy Lube? Like when you tell them, you don't need to change your oil that much. Well, it's their business to change oil.
Right, exactly. So like I talked to this one amazing, child psychologist who said to me, I start by having my patients sign a waiver in which they acknowledge that there can be risks. And the reason I do that is because I don't want them to experience harm. So if they see that their worries are getting worse, they have to tell me.
But do they? Would they? I mean, it seems like the therapist is the one who's in control, right?
Right.
The therapist is the expert. They're the one who has the authority.
Right. Well, I mean, this one was Camilo Ortiz was one of the, he was the one I talked to, and he was the one that I was referring to there. And first of all, he always starts a therapy by setting the number of sessions. It's not, he doesn't treat a kid like an annuity. You're going to, be my income stream for years.
Right.
He attacks, and also they come to him with an actual problem, like chronic bedwetting, like, various kinds of phobia. There are people who treat anorexia. They're tackling a problem.
Right.
And some of those therapies are extremely necessary and very successful.
When this person that you were just describing, if they get someone that comes to them that doesn't have a real problem, do they turn them away?
Well, you can ask, but very often the therapists don't turn them away.
So it begs the question, when have you been to therapy, or when has your child been to therapy, and they update you on real progress, or they talk to you about potential side effects, or they give you a consent form acknowledging the possible harm, or they give you a limited number of sessions with the goal to graduate? Yeah, me neither. So let's get into the 10 mechanisms and that she talks about in her book. So, number 1, and this one caught me off guard, teaching kids to pay close attention to their feelings. I want to say off the bat, I think there's a difference between teaching kids how to regulate their feelings and teaching kids about their emotions versus teaching kids to obsess over their emotions. Or have you ever had a therapist validate something that you later realized was totally off? It might sound good at first, like listen to your heart, trust your intuition, trust your gut, except in this case, your gut has been carefully programmed by a manipulative parent. In my case, for instance, every feeling and belief I had was conditioned into me by my mom. You feel anxious around your dad? That's your intuition. But it wasn't my intuition. It wasn't my intuition, and I didn't know better. And so every therapist nodding along like, wow, you are so emotionally attuned. You are really, really intelligent about how you're feeling. No, I was held emotionally hostage. There's a difference. Second method of bad therapy, induce rumination. This one is a classic. Instead of helping you process a thought or a feeling, bad therapy encourages you to keep replaying thoughts, feelings, trauma, like it's a Netflix show that no one asked to be renewed. I call this binging your pain. Whether or not a therapist intends on causing their client to ruminate, especially in the situation where a child is being manipulated, this can cause unbelievable harm. Week after week, it was, tell me again why you're scared to sleep over at your dad's house. Explain to me why you feel angry again, and tell me exactly why you don't want to see him. In fact, when I went to child therapy at age 9, 10, 11, 12, hell, my entire upbringing, my therapist, I remember this clear as day, had what she called a worry wall. And this was a thing on the wall. It was a paper, and it was like a stoplight. At the top you had red, or at the top you had green, and then you had yellow, and then red at the bottom. So I had to take a sticky note every session, once a week. And I had to write all my worries and my anxieties, fears on the sticky note and put them in green, yellow, or red. So I had the greens, which were really not worries at all. Like maybe I will not do well on my math test, or maybe I won't do good on my basketball game. It was silly stuff I wasn't really worried about. And then yellows would be things like, I'm worried I won't sleep well. I'm worried I won't fall asleep fast enough. But every week, every single week in therapy, without failure, I would take those sticky notes and write the same reds over and over every week for years. I don't want to see my dad. I don't want to go with my dad. I don't want to sleep over at dad's. Just again and again, like on a hamster wheel. And while this rumination might feel productive, maybe to the therapist, I guess, like I was working through my worries, really it was mental quicksand. That is not helpful for anyone, especially not the child. So good therapy, I believe, should help you move through your emotions, not set up a campfire in it. And did that worry wall help me? No. It made things worse, actually. It kept my fear spinning and encouraged what I said is pain binging. In fact, in her book, Abigail Shrier states that, quote, a good therapist should do what cognitive behavioral therapists do, prove to a patient that rumination is an unproductive mode of thought and train them to stop. Number 3, the third mechanism of bad therapy. Make happiness a goal, but reward emotional suffering. This one is this one's genius in its dysfunction. So you're going to tell kids that you want them to be happy, that they need to aspire to be happy, but only praise them when they're miserable. And if this doesn't make sense, bear with me. So growing up, my therapist, and well, I should say plural therapists, because I had a lot of them, acted like I was doing great work and like I was making breakthroughs every time I cried about my trauma with my dad or complained or, had emotions about the situation with my family. But surprise, surprise, that never helped me heal. Never. But apparently healing was not the vibe they were going for. And that shouldn't be surprising since we live in a society that praises victimhood. I actually had a really good therapist, which is the last therapist I went to. And guess what? I graduated. Yeah, that's right. If your therapist doesn't have a goal of getting you better in order to graduate from therapy, seek a new therapist. Every therapist should have a goal to graduate you. You should not be in therapy forever. Okay, so the fourth mechanism for bad therapy: affirm and accommodate kids' worries. This is basically to affirm everything. And when it comes to psychology, I'm sure some of you have recognized this in our culture today. We have been in the era of affirmation. Therapists are supposed to help kids reality tests and not turn their worries into an emotional constitution. And unfortunately, most kids who are alienated in therapy today will be affirmed in their parents' delusions. That's just the reality. And compassion doesn't mean agreeing with a child in therapy. I want to make that very clear. Compassion does not mean agreeing with a child, in or out of therapy, actually. Compassion is helping a child test their beliefs. Compassion is actually allowing a child to live in reality, making sure a child is living in reality. In her book, Shrier offers the following example, which I love because I think it's very applicable to this specific family dynamic. She says, quote, a core tenet of therapies like CBT is that a kid's extreme aversion to, say, dirt, may be based on the false belief that dirt is harmful. The best way to demolish this maladaptive belief is for your kid to have direct and repeated contact with the thing she is afraid of. If your kid is afraid of dogs, you prompt them to pet a dog. Exposure therapy is CBT's escalating method of encouraging patients to confront things that make them uncomfortable. It is among the few therapies with an evidentiary track record of benefits. So if your kid's afraid of dogs, you don't teach them to avoid dogs forever. So when a kid fears a parent, why do therapists let them avoid that parent entirely? Well, I think you probably can guess the answer. Most often, the therapist is buying into the narrative. When the child refuses to go with that parent or see that parent, the fear intensifies. Instead of having direct and repeated contact with the subject that is causing the intense fear, the child is allowed and enabled to avoid the subject of their fear, their other parent. And that reinforces the child's fear. It causes it to balloon. Number 5 is monitor, monitor, monitor. This is about surveillance and the parental hovercraft model of therapy. However, monitoring every moment of a child's life has been shown to actually add anxiety. And now I do understand the importance for parents to protect their children and to be informed and to know what's going on with their child. I do. I really do. I'm a parent of 3 kids, so I get it. But there's a fine line. So in the book, Shrier references Peter Gray, who's a professor of psychology at Boston College. And Peter Gray said the following: when psychologists do research where they want to add an element of stress and they want to compare people doing something under stress versus people doing something under no stress, how do they add the stress? Well, they simply add an observer. If you're being watched by somebody who seems to be assessing your performance, that is a stress condition. So constant monitoring creates this stressful environment for the kid where they'll have a difficult time being who they truly are. They become disconnected from their authentic self. And I can tell you from firsthand, having a parent where you know they're constantly monitoring you and assessing you, no wonder kids end up with complex CPTSD from the constant stress of that. Number 6 is, here's where we're going to get into some real deep stuff. And not a lot of people actually want to talk about this stuff, guys. So thank you for being here tonight. Buckle up. This is not pretty. It's important to talk about. Number 6, dispense diagnoses liberally. Nothing says progress like a fresh diagnosis, or 2, or 3, hell, maybe even 4 or 5. Anxiety, depression, OCD, adjustment disorder. Is it sounding familiar for you and your kids? ADHD, ADD, because the psychologically abusive parent flies under the radar. So their child is often left wondering, what's wrong with me? And the therapist, not recognizing that the child has a psychologically abusive parent, diagnoses the child with a whole bunch of crap they don't actually have. For instance, I was diagnosed first with anxiety and childhood depression, and then with OCD. The list just kept on going for 20 years. And every new therapist I went to seemed to want to add their own label, like Pokemon cards of pathology. Except I'm a person. This is my life. And each of those diagnoses stuck, not only on a medical record, but in my psyche. Meanwhile, not one of them said, hey, maybe the problem isn't you. Maybe it's that your mom has been psychologically harming you, destroying your relationship with your dad, destroying your self-esteem, destroying your mental health. And I do get it. Parents and therapists want to help their children succeed. But as Abigail Shrier so rightly explains, obtaining a diagnosis for your kid is not a neutral act. It's not nothing for a kid to grow up believing that there's something wrong with their brain. Even mental health professionals are more likely to interpret ordinary patient behavior as pathological if they are briefed on a patient's diagnosis. End quote. I want to repeat that for emphasis because this is so close to home for me. It is not nothing for a kid to grow up believing there's something wrong with their brain. It's not nothing. It's not a neutral act to obtain a diagnosis for your kid. While identifying significant problems is often the right thing to do, if your child actually has legitimate problems that can be diagnosed as such, doctor shopping and pursuing a diagnosis at any cost might truly saddle your child with a new negative understanding of themselves. If this is resonating, please let me know. This is such a common situation I've heard from people who've been through it. It's almost impossible, it seems, to go through this family dynamic and to come out of it without diagnoses. I want to repeat that diagnoses can be useful. They can be useful. There are things out there that children suffer with, absolutely. But diagnoses are only useful when it leads to clarity and healing, when it leads to treatment that actually treats them. Otherwise, it is just a participation trophy for suffering. Number 7, your kid is given a diagnosis. This might bring some parents relief, but more often than not, it's the beginning of a terrifying pipeline. What do you think is the next step on the pipeline after the diagnosis phase? If you guess medication, you're the winner. Congratulations. You see, because after a diagnosis, then comes medication. Yeah, and more money too. But medication, the chemical solution to emotional sabotage. After the label comes the pill. This was my life for 20 years. This is not just my life, by the way. This is the life of millions of children worldwide. That's why I'm doing this. I was 12 when I got my first prescription, an SSRI. And was I able to know what that was? Did I know why I was being put on it? Did I know the side effects, the ramifications, the long-term effects it would have on my life? Did I even know what the heck an SSRI was? Absolutely not. Was I able to give informed consent? No. Did I need this pill? No. But nothing says treat the family system like chemically muting the child caught in the middle. In her book, Shrier states, altering your child's brain chemistry is about as profound a decision as you will ever make as a parent. She says, but for many child psychiatrists and far too many pediatricians, it involves little more than a signature in tearing off a sheet gummed to a prescription pad. Medications numb the child's sadness. It numbs their anxiety, but they also numb everything else. When I was put on medication, I wasn't getting better. I maybe was getting quieter, easier, more compliant. So instead of encouraging the child to learn to deal with pain and suffering and life's hardships, or to develop the capacity for emotional regulation, many parents and therapists are quicker to push pills. Not to mention the many morbid side effects of such psychiatric medication imposed on adolescents or teenagers who are already suffering. Weight gain, insomnia, nausea, fatigue, jitteriness, a risk of addiction, and of course, brutal withdrawal down the line. But as Abigail Shrier points out, possibly the grimmest risk, and I want everybody to listen real carefully for this. Possibly the grimmest risk of antidepressants, anti-anxiety meds, and stimulants is the primary effect of the drug themselves. Placing a young person in a medicated state while he's still getting used to the feel and fit of his or her own skin. Making him feel less like himself, blocking him from ever feeling the thrill of unmedicated cognitive sharpness, the sting of righteous fury, compelling him to play remote spectator in his own life. When you start a child on meds, you risk numbing them at the very moment he or she needs to be taking risks, to be celebrating, to be feeling strong emotions, to be learning how to handle the ups and downs of life. Also, once you are put on the pathway of medication, it's often very hard to ever get off. But I mean, maybe the psychologically abusive parent just doesn't even care about that. Maybe they prefer their child to be essentially a little zombie. Maybe they like their child having tons of problems so they can be the hero and get tons of accolades and sympathy for having, such a messed up kid, such a sick kid. Maybe that way their child won't ask them the difficult questions. Maybe that way their child will never realize they're living in a delusion. Mom, listen, Medication can save lives. We all know that, but it cannot fix abuse. Let's watch this clip of Abigail Shrier in her own words, describing to Jordan Peterson the risks of handing one's child over to a therapist.
I'm not someone who's against therapy. I'm not someone who denies that it can be important and very useful and even curative. But when you treat kids who actually don't have a severe problem, you're at much greater risk that the therapist will just introduce harms. And I saw it firsthand, but there's another problem, which is why are parents handing over their kids to therapists at the first indication of any problem? In fact, no matter how minor deviation from a benchmark, they go to diagnose and medicate. And the problem is not only do we not know what goes on in that room, not only does the profession make no effort to track harmful effects of their interventions, unlike doctors who are mandated, to report side effects of their drugs. Not only is that going on, but we're seeing kids have these harms and there's no feedback mechanism. Anxiety is worse. Therapists don't track whether their treatments have made anxiety worse or depression worse for a kid. And we know therapy can do that. And we certainly know the therapeutic interventions, the focus on feelings constantly ruminating on sad moments in your life, the way they're asked to in school. All of that is very bad for mental health. And constantly questioning everything you're going to do before you do it. All of these are the opposite of what we would want young people to do. And that's what therapeutic schooling efforts have done, parenting efforts have done, and actual therapists have done. And I'll say, the last thing is that, parents' unwillingness to assert their own authority in their homes has been a disaster because it let therapists in the door to be that authority.
I get so fired up about this stuff because it destroyed my life for so long. And I have such a wonderful life now. I mean, full of so much joy and meaning and purpose and happiness. And I never would have had that if I had continued on that pipeline that I was put on as a child. And I don't want more children to be put on that pipeline, to stay on that pipeline. Gotta get them off. Gotta get them off the pipeline. Number 8 is encouraging kids to share their trauma. This one might sound noble, like let the kid have a voice. Listen to what the kid wants. Except in this family dynamic, when the child is manipulated, the trauma the child is sharing is actually scripted by a vengeful, pathological parent. I didn't know it at the time. I thought that everything I believed they were all my own beliefs. I thought that was that. But I was basically just a microphone for my parent. And I was under intense mind control. So not only were my words not my own, but neither were my emotions, neither were my beliefs. And instead of focusing on the present or the future in therapy, the alienated child will often be stuck in the past, rehashing false memories or repeated narratives as to why they've decided to cut their parent out or why they're afraid or angry at their parent. And in these situations, not only is the child reliving the trauma and reliving it physically in their body, but the trauma narrative will also become more and more entrenched in their own identity. Number 9 is to encourage young adults or even children to go no contact. And that brings us to the holy grail of bad therapy, the toxic family narrative and the going no contact. And before I get into this point, I can already hear people saying, you're being hypocritical. I want to make something very clear, very explicit, okay? Very explicit. Of course, it is true that some people have to go no contact with family members. It is absolutely true that people have family members that are truly harmful, truly abusive. I would be a hypocrite to say otherwise. My own mom psychologically abused me for decades. And I'm currently no contact with her. Sometimes no contact is necessary. However, the difference that I see here is that I made that discovery and the aforementioned decision as an adult without the influence of a therapist. That's the difference. The final mechanism of bad therapy proposed in Abigail Shrier's book is to create treatment dependency. And this reminds me of the point that I mentioned at the beginning of the episode, which is about money and incentives. So the last point of bad therapy involves keeping you in the pipeline forever, keeping the kids coming back, actually getting the kids in the pipeline and then keeping them throughout their entire lives through adulthood. So creating treatment dependency. And this also includes psychiatrists with drugs, by the way. Good therapy helps you graduate. Bad therapy keeps you enrolled forever. Therapists, this is what Abigail Shrier says, therapists can do harm to someone's agency and belief in themselves. And a patient inducted into the habit of consulting with a therapist may become convinced that they cannot ever act without the expressed approval of an authority figure. So, in other words, the patient might be so used to getting their therapist's opinion on each and every decision that they make in their lives that they become too afraid to act without the approval of their therapist. This can go for adults as well. That's pretty sad. So instead of therapists teaching their client to trust themselves, too many therapists, these bad therapists, create patients that are dependent on them for getting through the day. Shouldn't the goal of therapy be to graduate? Yes. Good therapy helps you graduate. I graduated, and that's because she was a good therapist. She told me on day one, listen, I don't want you to be in here forever. We're going to get you to the point where you graduate. And I thought, I've never had a therapist say that to me before. Thank you. I don't want to be here forever. I want to play one final clip, and it's on the distinction, which I think is a very important distinction, between child therapy and adult therapy.
It's very different when you're an adult in therapy because you have the ability to push back on a therapist. You can say to a therapist, listen, I think we're blaming my mom a little too much. You can say to her, I'm not sure I gave you the right impression. It's much harder for a child to say, I don't think it's fair to call what my mom did abuse. It's much harder for a child to do that. So there's much more potential for it to be undermining of the child's sense of agency and efficacy and power in the world.
Yeah, really important. It was not actually a therapist that opened my eyes, that changed my life and made me see my toxic family members' abuse. It wasn't a therapist. It wasn't a therapist that led me to reconnect with my dad. It wasn't a therapist that helped me create my wonderful life that I live now. And I did finally reconnect with my dad. I did finally get away from the psychological abuse. It took 20 years and 0 therapists. It was critical thinking and a belief in myself that changed everything. And here's a question I want to leave you with tonight. What is good therapy? What would good therapy look like for a kid who's been manipulated to reject one of their parents? I have a few ideas I would like to share. We're going to really get into this in episode 3, so not next Wednesday, but the Wednesday after. But I just want to leave you with a few ideas, which would be, it certainly would not have looked like affirmative care. Good therapy, in my opinion, would have said, let's test your beliefs. Let's hear both sides. Let's make sure that what you're feeling is actually true to the facts. Good therapy would have said, let's make sure that your thoughts and your feelings are appropriate to the situation. Let's make sure that your opinions and your beliefs haven't been shaped by others or influenced by others. Let's practice living in the moment. Let's work on facing your fears. It would not have said, let's talk about why you're scared to go to your dad's again and again. Let's get out that sticky note. Let's get out that notepad. You got any reds for me this week? Yeah, I've got reds for you, the same damn reds I've had for you every other week for the past 2 years. It would not have done that. It would not have said, here's a new diagnosis. It would not have said, let's start you on this medication. Good therapy would have screened me as a kid, as an adolescent, as a teenager, and as a young adult for signs that I was experiencing psychological abuse. Good therapy would have insisted on a protective order for me from my abusive parent. As always, thank you so much for being here. I hope you found it helpful or insightful, and I will see you next Wednesday.